Hi, welcome to EMS World. I'm John Eric. We're here today with attorney Doug Wolfberg from the esteemed EMS law firm Page, Wolfberg & Worth. Doug, thank you for joining us.
Good to be with you.
Let me ask you first, I understand there are some changes coming to HIPAA. What should EMS folks know about what's going to be changing?
Well, this is the first massive overhaul of HIPAA since the original privacy regulations went into effect about 7 or 8 years ago. So it's widespread. The changes are going to be significant. The privacy notices that are handed out to patients, those are going to have to be amended. Agreements that ambulance services have in place with companies called business associates are going to have to be updated. And probably the biggest thing companies need to be aware of, and providers, is that there are significant new enforcement provisions put into the law and the regulations. That means it's time to step up our training and continuing education efforts on patient privacy. Everybody went through the initial HIPAA training back in the day, but it's important to reinforce the importance of patient privacy and how it's everybody's responsibility to protect that. So we're really going to be emphasizing training, refreshing that training periodically among all personnel, whether they're field providers, billers, managers, supervisors, contractors, it doesn't matter, because the penalties and the enforcement provisions in the new law are pretty substantial.
A lot stiffer for violations?
Much stiffer for violations, and maybe the most scary thing is that HIPAA is a federal law, but the new statute gives states, the state attorney general in each state, gives them the authority to enforce HIPAA in the name of the federal government. So it really multiplies by 50 the number of HIPAA police, if you will, that'll be out there.
Is that likely to lead to different interpretations in different states?
You know, that's a great question. It's possible. Now, generally, you would expect that these cases would be heard in federal courts, but there can still be some inconsistencies even between federal courts. So how the case law evolves under HIPAA remains to be seen, and there certainly could be some inconsistencies. That's just a great question.
Now, how are folks doing with getting their arms around the Patient Protection and Affordable Care Act? What is healthcare reform meaning to folks that you're talking to?
Well, right now it means just a lot of uncertainty, and we're trying to work hard to bring some certainty to that through our educational outreach and our programs and the work we do with our clients. So right now there's just big question marks. I think some of the more immediate things that folks are going to see, unfortunately, there's going to be something called a productivity adjustment that is a result of the new law that essentially assumes that healthcare providers are going to get more efficient over time and therefore reduce the amount of reimbursement that they're paid for the services they provide. And I think it's hard to get efficiencies out of a healthcare system that is constantly in flux and change,
Sure.
Trying to stay on top of all that. So whether healthcare providers actually get more productive remains to be seen, but the federal government does intend to try to reduce or at least rein in increases in reimbursement based on this idea of productivity. So we've got to become more efficient. We've got to buckle down on quality improvement. We've got to prove that what we do makes a difference before we go out there and continue to ask state governments through Medicaid programs, the federal government through Medicare, to pay substantial sums of money for services that aren't necessarily proven. So it's really incumbent upon us now to redouble our efforts at quality improvement, to really focus our clinical decision making, make sure the things that we do work, and that they have a positive impact on patient care.
Now, is it true that Medicare claims are facing greater scrutiny these days for fraud and abuse?
Well, absolutely. And one of the things that President Obama made no secret about was that one of the ways he wanted to help fund the new benefits provided under the health care reform law were to sort of squeeze the fraud and abuse out of the system. That's not a new concept, but it does seem that this president is putting more of a focus on that than any president before him. And the penalties and the enforcement provisions worked into the new law are significant. One of the things that I personally think is the most significant, that I haven't seen a lot of writing or commentary on yet, is a change to the Civil False Claims Act that allows private whistleblowers to bring false claim cases based on violations of a law called the anti-kickback statute, which prevents people from giving inducements or paying money for referrals or giving anything of value to get business from somebody. And previously, only the government could come after you for violations of that law. Now, if, say, an ambulance service gives some illegal compensation to somebody to refer business to it, any claim, any service that results from that referral arrangement that's an illegal arrangement is a false claim to the government, and a private whistleblower can bring an action to enforce it. Little complex, not to get too deep in the tall grass here, but that's extremely significant. And companies that are out there giving impermissible discounts to facilities, or we'll come out and do free CPR training for all your staff if you use our ambulance service, those kinds of things are going to be under severe scrutiny, and services that do that face the threat of these private whistleblower actions now.
Is there a financial incentive for these whistleblowers?
Sure, it's an enormous incentive. It could go up to 30% of any funds that are recovered by the government. And we're not usually talking about one claim here. If you're violating the law, you're probably doing it with hundreds, if not thousands, of ambulance trips.
Right.
So not only are the amounts of money that the ambulance company might be required to pay back, those amounts might be substantial, but then a private whistleblower, has an incentive of up to 30% of any of those funds to bring that case. So
if I'm a chief of an agency worried about some of these changes, what steps should I take immediately to start getting my affairs in order?
Well, probably the best thing we can advise everybody to do is put into place a comprehensive compliance program. Now, the government's been talking about the importance of compliance programs for years. Also, not a new notion, but the importance of doing a compliance program now it's just more critical than ever. Now, a comprehensive compliance program has a lot of elements: personnel training, formal written plan, personnel code of conduct, reviewing claims and making sure that when you're billing services to the government that you're doing that with the appropriate codes and in the appropriate amounts. All of that really gets rolled into what we'd call a comprehensive compliance program. If I could pick one thing that your viewers should take away, it would be to implement one of those programs sooner rather than later.
Generally, are compliance programs good enough, or they need upgrading?
They always need monitoring, upgrading. New laws change. We've seen a dizzying pace of new laws in the last year. That's going to continue, I think. So compliance programs need to be sort of living, breathing, evolving projects that need to be always updated. And they can't just be these, documents or, hey, I downloaded a compliance plan I found on the internet, and you sit it on your shelf and it never really gets followed. Nobody knows what's in it. It has to be something that's used and something that's operationalized, or it's going to serve you no good.
Doug, for folks who would like more information or to contact you guys about these issues, what's the best way to go about that?
Well, we always like to suggest people visit our website, which is www.PWWEMSWorld.com. And on that site there is an EMS law library that has a catalog of information on different subjects, including HIPAA, healthcare reform, Medicare, compliance. There's a lot of free stuff on there too that people can download, some model forms, policies, procedures, and things of that nature.
Very good. Doug, thank you for being with us.
My pleasure. Thank you.